Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, function better, and live as many quality disease-free years as possible. Thanks for joining me this week, and I hope you had a wonderful week and enjoying your weekend. We're coming off of a topical show last week. We did some ergonomics, and we've been staying on the physical realm of the triad of health. Remember, the triad of health is defined as the physical, nutritional, and psychological nature. So many shows ago where I've set forth the parameters of this show, we talk weekly on either topics or foundations that revolve around both the pyramid of health and something called the triad of health. If you would ever like illustrations of either the pyramid or the triad, please contact me at ProodianHealthcare.com. There's a way you could submit a question, and I'd be happy to send them to you. These are posters that I've developed, and they hang on my walls in my office. The physical, nutritional, psychological approach is basically God's design for us that when we wake up every day, we have to use our psychological, meaning our mental, emotional state, our relationships, our communication. We have to use our nutritional. We have to feed ourselves. And then finally, we have to use our physical bodies. And our physical bodies is what we've been focusing on over the last maybe 4 or 5 shows on structural integrity. And last week, we did a little bit of ergonomics at the workplace, sitting, how to position your chair, your monitor. I wrote a piece about ergonomics many years ago. It's on Dr. Proodian's Press, which are articles that I've written for the newspaper. You could find those at naturalhealthcarecenter.com, which has Dr. Proodian's Press as a tab. My blog, drproodian.com, recently I blogged on how to get a better workout in just minutes a day. And because I just recently blogged on that, I figured I'd get into some shows on physical exercise now that we've come out of structural integrity, and we're going to do a little bit of summary today on structural integrity and then get into exercise and getting into what exercise is proper for my physical state. So Luke 1:37, for with God nothing is impossible. We take the approach here at By Design that if we know tragedy and trauma and things that we cannot avoid are out there, the show is not focused on those. The show is focused, and we realize that at any moment it could be our calling card, and but that's not the intent of the show. By Design is all about how do we use God's design to live our lives every day, physically, nutritionally, and psychologically, honoring Him and his design, his creation, and not following man's design, which has taken the physical, nutritional, and psychological. And if you go back to some earlier shows where we went through what exactly the state of our nation is in with respect to obesity, type 2 diabetes, depression, anxiety, and a whole host of chronic illness that is costing us dearly. It's costing us so much that now our government has stepped in, and whether you're for or against the Affordable Care Act, it's here. And it's here because from a large majority of the reason why is that somewhere around 16 to 17% of the GDP is spent on healthcare, and it's getting worse. So our country is pretty much going bankrupt at the cost of healthcare, and you have to ask yourself, well, if we were all so healthy and we were using the healthcare system less, the cost would go down. But since we're using the system so much more, because of 70% of all illness that's being treated right now in our doctor's offices is chronic illness. It's not the type of illness like I fell off a ladder and I broke my arm. So let's take a look at the triad and say physical, nutritional, and psychological. There are times where we absolutely have tragedy, unavoidable trauma, and we thank God we have providers to administer healthcare. But when we look at chronic illness, which are the things that are really inhibiting us, and a lot of it is due to man's design. Again, that's not God's design. We wanted to follow, God's plan for health. Our bodies are in a constant state of change. Last week, I discussed this word flux, and if you look at it, our human physiology, our anatomy, physiology is constantly changing. We're never staying the same. So as we, go from the state of being an infant to adolescent to a teenager to, let's say 20s, 30s, 40s, 50s, you've been there. You've experienced the change, not just physically in what you look like in the mirror, where we used to have more hair, or last week I shared with you, all of a sudden I woke up one day and I needed eyeglasses. Well, my body is in a change of change, and we should welcome that. That is the glory of our existence. And our physical state, our nutritional state, and our psychological state does change as we go through these periods of our life. I have 5 children, and I remember I think back to the days before 1999, before my first daughter Hannah was born, and I think about my mental state prior to having 5 children in 9 years. And yes, we can make a lot of jokes, and I'm sure there's a lot of parents out there giggling, about the fact that, life was certainly different prior to having children and prior to being even married, and responsibility in life. And so when I design these shows or think about these shows, it's not about the scale, it's not about the mirror, it's not about, focusing the majority of our time every day on our physical, on our nutritional and psychological. I'm just saying that we should give the physical, nutritional, and psychological some part of our day as we go about our day. And the goal is to follow what was the design. So, last week when we looked at the physical body, or I should say the last bunch of weeks, we've been looking at this physical body. And I gave you some tests to do, like bend over and touch your toes. Can you, keeping your legs straight. How to do a proper squat. How to do a proper lunge. And these tests are on a blog that I did, a while ago called Home Mirror Tests. So you could look those up, and there's pictures associated with them. And the problem, why this is so important, is because so many people are in pain. And why are so many people in pain? And we're talking about non-traumatic pain, meaning if you had a car accident or you fell down a flight of stairs, we could understand physical pain. But so many people are suffering from chronic non-traumatic pain, and it has so much to do with our posture, how we take care of ourselves, us being out of shape, overweight, non-flexible, and not working on our musculoskeletal system. And every day we should do something for our musculoskeletal system. You see, one of the problems with our society is we're not just overweight, but we're under-muscled. So it's not simply enough to look thin. Looking thin, I don't know what that means. We want optimal body composition. Now, body composition is an interesting word because when you step on a scale, you can't measure body composition. Body composition means that what percent of my body is muscle, what percent is fat, what percent is air, what percent is water, for instance. So our bodies are comprised of a bunch of different materials, not just step on a scale and I weigh 175 pounds, for instance. Well, what are we really weighing? How much of that is bone, for instance? So getting a true body fat measurement is an important thing to do. Just like you go for your blood tests, we should be going for our annual physicals and getting our bloods taken, a CBC, a chemistry. Remember to check your vitamin D. I just blogged on that this past week. We want to make sure that the biometric markers are being monitored by someone, and that begins with blood testing. Blood pressure, right? If we're over certain ages, we should be getting prostate exams, mammography. We should be seeing cardiology if in fact that's necessary for stress tests and such, chest x-ray. But the thing that gets heavily overlooked is what is your body fat percent? And it's a very, very simple thing to do. There are those of us out there doing it. And it's very important that if we are in a deconditioned state and now we're going to go and get conditioned, we may not want to start off with, Joey at the gym who's home from college break. And if I'm a 45 to 55-year-old female carrying around 50, 60 extra pounds, raising 3 children, stress of life, that might not be the best person to take advice from. So what I mean by that is, when we started reconditioning program, seek by professionals advice, who's going to do the blood testing, who's going to check your biometrics, because monitoring muscle mass is critically important. The more muscle you have, every study shows, the longer that we live. Muscle is a critical component to our longevity. So as we learn how to build muscle, and it's certainly easier to build muscle when we're in our teenage years, 20s and 30s, than it is when we're in our 60s and 70s. But that does not mean we can't do activities to promote muscle tone and actual muscle growth. So our metabolic machinery over a period of time, as we age and go through life and become deconditioned, doesn't necessarily build muscle at the rate it used to. Now, our metabolic rate, you hear so many people talking about they have a slow metabolic rate. I can't lose weight because I have a slow metabolic rate. What actually is your metabolic rate? What your basal metabolic rate is, that's BMR. Your basal metabolic rate is the number of calories that you burn in a 24-hour period of time if you were just lying down and at rest. So think about that for a second. If you laid on the couch for 24 hours, how many calories would your body consume during that 24-hour period of time to keep you awake? That BMR, you want that as high as possible. And again, there's ways to measure this. So let's think about your BMR. Your BMR is like the furnace in your house. You want a high, efficient burning furnace. You want this puppy really churning and burning because you want to be burning calories while you're at rest. And if you burn calories, higher amount of calories while you're at rest, that means that your metabolic machinery is in good shape. So there are factors that raise BMR. Okay, kids, for instance, and pregnant women have a higher BMR. A fever, we've all had fevers. When we're in that state, your BMR goes up. Okay, thyroid hormone like thyroxine, that so many people are hypothyroid, that lowers your BMR. If we're going to raise BMR, we want good levels of healthy thyroid hormone in our bloodstream. How do we measure that? With a blood test. Okay, that's called a thyroid panel. And you measure thyroid hormones and you measure thyroid ingredients, if you will, on your blood test. So that's why that yearly physical is so important, that we're looking at thyroid dysfunction. So many people are hypo or moderately hypothyroid, okay? And you want to look at the amount of fat mass, FM, that you have on the human body, and fat-free mass that's on the human body. Once again, you need a specialized scale to do that. We do that down at Natural Healthcare Center. The scale is about $5,000, but it measures what percent body fat is on the body, how much fat mass is on the body, and how much fat-free mass is on the body. So we know as a starting point that if we have a patient who's 30 to 40% body fat and is clinically obese, we're going to monitor them through biometric measurement, blood tests, as well as monitoring body fat, as well as how much fat-free mass is on their body. Now, the fat-free mass includes muscle. So we want to see that fat-free mass go up a little bit as we put people on exercise programs. How do we lower BMR? Fasting and starvation. So the best way to lower BMR, which is not good for you, remember we don't want to lower BMR, is go on a fad diet. Go on a calorie restriction diet and you're going to lower your metabolic rate. It causes a ton of stress in the body. Don't do it. Stay away from fad diets. Stay away from diets in general. Remember I shared with you the first 3 letters in the word diet is die. You die on a diet. There's no such thing as a diet. You'll never hear me talk about diets. So factors that lower BMR: malnutrition, nutrition deficiencies, chronic stress, being toxic, and thyroid fatigue, like we talked about thyroid earlier. So factors that lower BMR: fasting and starvation, malnutrition, chronic stress, toxic burden, and thyroid fatigue. So remember, we want to increase our BMR. Men, we want a waist circumference of 34 or less. Women, you want 29 or less. Men, our ideal body fat percentage is between 10 to 18%. Clinical obesity in a man is about 22% or more. With women, the ideal is about 18 to 25%. You guys carry around more body fat than we do. That's the way God designed us. Clinical obesity in a woman is 30% or higher. Okay, so when we look at body fat, and again, measuring for body fat, we measure waist circumference, we measure body fat, and then we want to set goals for the amount of fat mass that's on the body and the amount of fat-free mass that's on the body. Once again, you have to measure those things. So those are some of the indicators on metabolic rate. We want our metabolic machinery not to be dysfunctional, but it becomes dysfunctional with lifestyle. Many times it's due to inadequate sleep, poor nutrition, ineffective or no exercise, chronic untempered stress. These are ways in which our metabolic machinery becomes tired, it becomes fatigued and dysfunctional. So chronic untempered stress, inadequate sleep, poor nutrition, ineffective, and or no exercise. So when we look at metabolic factors, the areas of what's called weight loss resistance, many times our bodies become resistant to lose weight because of the metabolic damage. Let me repeat that. If you're one of those people, like you just can't lose weight, and you're trying the diets, you're doing the calorie restriction, you're tired, by 2-3 o'clock in the afternoon, you got to have the coffee, you don't feel well, and you're doing this, you may have metabolic damage. That metabolic damage has to be diagnosed, because with weight loss resistance, there are steps that a clinical nutritionist takes, for instance, to improve the BMR before you begin an exercise program. So the benefits of exercise, which are wonderful, and we'll get into the benefits of exercise, we first have to be clinical. We first have to use the science behind exercise and behind proper weight loss and BMR in order to do the proper diagnosis. Well, thank you for joining me this week here at By Design. Remember, if you have a church or an organization you'd like me to come out and speak at, I've been speaking for about 20 years now through a company called Wellness at Work, and I am taking my By Design radio program on the road to churches and organizations that would like me to do a presentation. If you have any questions for me, please submit them at ProodianHealthcare.com. This week, let's work on our metabolic rate. Let's avoid the things that are going to lower the metabolic rate, and let's build a really strong, efficient furnace. And we'll get into exercise and proper types of exercise in the next bunch of shows. And God bless you, and have a wonderful week.